Welcome to today's session. We can do this, educating nurses and pediatric staff about COVID-19 vaccines for children. My name is Elizabeth Breitenbach. I'm a meeting and event specialist based in the Clinical Affairs Division here at NAC, and I'm pleased to bring you this event along with my division colleagues. At this moment, I'm going to be turning things over to my fantastic colleague, Wanda, who's going to be moderating today's session and kicking things off. Wanda, the floor is yours.
Thank you. So I want to encourage folks today that if you're on social media to please tweet out some of the content today to help promote the information. We will be responding to questions towards the end of the webinar. Next, I want to introduce our speakers. Our first speaker is Dr. Lisa Costello. She is a lifelong West Virginian, and she is an assistant professor at the Department of Pediatrics at West Virginia University, and she is a pediatric hospitalist at West Virginia University Medical Children's Hospital. We're really lucky to have her today. She is currently serves as the president-elect of the West Virginia State Medical Association and is the immediate past president of West Virginia chapter of the American Academy of Pediatrics. She also serves at the state level with the Department of Health and Human Services Bureau of Public Health and is a member of the American Academy of Pediatrics Committee on State Governance Affairs. And you can follow her on Twitter at Lisa Costello WV. Our second speaker, we're really proud to have her today as well, as NAC is partnered with HHS, Ms. Erin Hemlin. She serves as its Strategic Partnership Director for the COVID-19 Public Education Campaign within the Office of the Assistant Secretary for Public Affairs at the Department of Health and Human Services. In her role, which I'm sure she's really busy, she helps to amplify the campaign's outreach through trusted messengers and via community partners who can help reach our underserved communities, hence the great partnership that NAC has with her and her department on this project. Prior to joining HHS, she serves as the Director of Health Policy and Advocacy for the Young Invisibles. And in part of that work, she helped inform and oversee health policy and public health education campaigns to help young people navigate our health insurance coverage system, which I'm sure is really important, especially given COVID and everything that's happened around the country, and really important and valuable work. Her master's in political science is from George Mason University and her bachelor's degree in political science from St. Edward's University. My name is Dr. Wanda Montalvo. I'm a senior fellow at NAC. I have been working on COVID for a long time, and we're really happy to put this webinar together to be informative, and I'm going to kick it off to Lisa to get us started. Dr. Costello, please.
Thank you so much, Dr. Montalvo, and thank you, everyone. Very grateful to be here and joining community health centers and appreciate the work that each of you do. And thanks for the kind introduction. If you go to the next slide, I don't have any financial disclosures. And to the next slide, really, today we're here talking about vaccination available for those 6 months and older. And so this is really a time to be hopeful. For those of you who care for children, the pediatricians on the line, this is something that we certainly have been advocating for in regards to ensuring that there were clinical trials to include our youngest population. And the AAP, as you can see here in our press release, it does recommend that COVID-19 vaccination occur for all infants, children, and adolescents 6 months of age and older who do not have a contraindication to receiving a COVID-19 vaccine authorized or approved for use for their age. That includes a primary series and or booster doses as recommended by the CDC. And we're going to talk about that a little bit today. And I think it's important as we, kick this off that the vaccine is important for the youngest members of our community who have waited the longest for this protection. So we know that COVID-19 is one of the leading causes of death in children. I personally have cared for many children hospitalized with COVID-19, from those who are newborn, a couple days old, to those late into their teenage years. So we know of the physical devastation that we can see. There have been thousands of children hospitalized. Unfortunately, hundreds of children have died. But we also know that there's been many other impacts of COVID on children, such as mental, social, health impact in regards to school closures or the inability to be able to do some of those typical items that children would be able to perform. And we're still learning about long COVID. So what are the impacts of COVID disease long term? And we also know a little bit about, and we're learning more about MISC, or multi-system inflammatory syndrome in children, in which all, again, can cause really severe disease in children. So this is a time to be hopeful, and we're going to talk a little bit more today about how we can implement vaccine delivery. So if you go to the next slide, I think really there will be some challenges ahead. In regards to vaccinating adults and adolescents, we had moderate success. Vaccinating 5 to 11-year-olds, however, who gained authorization back in the late fall, that's been a challenge, and we anticipate that trend to continue. The CDC late last week just gave initial numbers of this kind of under 5 population, and it's as we expected. There were about 300,000 in this age group vaccinated. I think that's for a multitude of reasons, and when we break it down here, I think it's really in regards to access, communication, and education. And so thank you all for taking time today. I'm looking forward to the questions that we'll each share as well when we're talking about what we can do to ensure that we have vaccine available for this youngest age group. So if you go to the next slide, this is a little bit of a highlight of those challenges that I talked about. So this is the proportion of US children based upon, as of last week, ages 12 to 17 who have received an initial dose of a COVID-19 vaccine. So we'll talk a little bit about the doses, because this is definitely complicated stuff, and what really constitutes someone being up to date. But you can see here a wide range of variability between states, from 40% to 100%. So depending upon where your community health center is located or where you're practicing, it's going to be different. And if you go to the next slide, you can see that the map of the United States is a lot lighter, and that means that our vaccination rates for 5 to 11-year-olds are not as robust as we've seen for the 12 and older. And so there's really a variety of reasons for that to have happened, and from regards to access, education, vaccine confidence, which we'll talk a little bit about, and really political will in some situations. So we certainly know that we have ongoing work to improve, to ensure that we're educating parents and caregivers about the importance of COVID-19 vaccination. We're going to talk about those things here shortly. So if you go to the next slide, I think it helps if we all try to promote a culture of vaccination. This is complicated stuff for sure. I think this is the first time really that we've seen, so much following and monitoring of the scientific process. I think every time I tune into ACIP and VRBAC, admittedly, I never watched a VRBAC meeting before the COVID-19 vaccines. I had watched ACIP meetings, but now, tens of thousands of people attend these meetings versus before, when, I don't think it was that robust. And so I think it's important to emphasize your center's track record of successfully delivering immunizations in children, and talk about childhood immunizations as the norm. We know that a large majority of people agree with immunizations. And so talking about childhood immunizations as the norm can really go a long way in helping to promote this culture of vaccination. And then particularly in the COVID-19 space, emphasizing safety. So child safety, school safety, community safety is really important. And we'll talk about that at the end when I have just some tips for communication resources. I think it's going to be really important to improve access and availabilities of vaccine. Unfortunately, there is a concern that there will be vaccine deserts. It's important to know your state and your state's policy. So in my state, where I practice in West Virginia, pharmacies can vaccinate to age 3. So anyone under age 3 is really going to be relying on their healthcare provider's office or the health department to be able to get access to this vaccine. So pharmacies have played such a crucial role in the entire vaccine rollout. But when it comes to this age group, there is some different special considerations that need to be taken into account. And so I think improving the access and availability, if we can take the vaccine to where the children are and what can be easy for parents, parents who are working, it might be hard to come during office hours. So offering evening clinics or weekend clinics. Children do have a side effect of fever, which is common, and we'll talk about that. If they have to take off work, a parent may not be able to get their child vaccinated on the day of the week, so they're looking at a end of the week or a weekend visit. So how can we really increase access and availabilities of vaccines? It's going to be really important to engage trusted voices, and that's you. So whatever role you play in the community health center, it's important. Your voice matters. So we have data from work that we do in West Virginia, and this is also supported nationally, that healthcare providers, broadly considered, from individuals who check a person in at a healthcare provider's office to the medical assistant or the nurse, all the way to the provider, they're broadly seen as a healthcare professional, and they are a trusted voice. So your recommendation, having these conversations, really go a long way. And I think we'll hear today from my colleague with HHS, as well as sharing some resources AAP has on how we can hopefully make that easier so that you have resources available to have these discussions. And then offer education and communication resources, or seek them out. So thank you for being here today to try to learn more. If you're in a position in your area that you could offer an information center session, I think that goes a long way in building trust of the public and building that vaccine confidence. So if we go to the next slide, this is an example in our state of how we've done this. So we've offered what we call just-in-time trainings, where we kind of break down, my colleague who's a pharmacist, and myself, where we kind of break down just high-level recommendations from what the FDA and ACIP says. So I'm going to share with you some slides here, and certainly give attribute to my colleague, Dr. Krista Capehart, who works in our Joint Interagency Task Force in West Virginia. But if you go to the next slide, we have 2 products available for our youngest now. And so this is really the first time in the entire rollout we've seen 2 vaccines authorized at the same time. Every time prior, we saw at least a week apart. Back in December of 2020, it was Pfizer first, and then a week later, it was Moderna. And then later in February, we saw Johnson & Johnson or Janssen. As of last month, the FDA authorized, and the Advisory Committee on Immunization Practices voted, and the CDC subsequently recommended Pfizer-BioNTech for ages 6 months through 4 years, which is a 3-dose primary series. The same process took place for the Moderna products. Initially, ages 6 months through 5 years, which is a 2-dose primary series, was authorized. And then of June 24th, the FDA, from their prior authorizations, and ACIP met and voted that Moderna for ages 6 years through 11 and ages 12 years through 17 were also authorized, and that is a 2-dose primary series. Every time I give a COVID talk, I always at some point say this information is current as of today. Many of you probably saw that very recently the Pfizer product for 12 to 15-year-olds received full approval through the FDA. So this is certainly information that we continue to monitor, and it is updated. So if you go to the next slide, and then go ahead and click through, we're going to talk about Pfizer-BioNTech. So one of the questions that was submitted is, are there resources available to kind of help? This is certainly, and I completely appreciate it, complex. So these are wall charts that the FDA has, and I'm also going to share a resource that the American Academy of Pediatrics has created that can be helpful. And I strongly encourage individuals who are administering vaccines to print out these wall charts and have them visible in your clinic or your location where you're administering COVID-19 vaccines. So this is for the Pfizer product. And so as you can see here, the maroon product, so the vial cap and label border color, so maroon, this is the product for 6 months through 4 years. It needs dilution before use. The amount of diluent needed is 2.2, and the dose volume is 0.2. For the purposes of this talk, I'm not going to go into the other age groups that you can see here, as these products have been available for 5 through 11 years, but certainly important to refresh yourself, your policies and procedures with what are you carrying at your clinic, and making sure that you're reviewing how to properly dilute these vaccines and properly draw them up and administer them, as well as storage. So if you go to the next slide, you can see here, this is for some of the formulations and storage as to where they can be stored in regards to the ultra low cold freezer, the refrigerator. So I think that there's a lot of concern with the Pfizer product that we frequently hear about storage challenges. So you can store this product for 10 weeks in the refrigerator. And then I think it's important in regards to the puncture time of the valve. So once you've punctured and have diluted the valve, it needs to be used within 12 hours. And so I think that's really important to keep track of that. And when you're strategizing, if you know, maybe you have or you haven't offered vaccines before, there's been a multiple different strategies that people have used in regards to providing appointments. And I think there's been a lot of concern about waste. And we've seen that, you know, time and time again, people are concerned about wasting unused vaccines. Certainly, this is something that we in the American Academy of Pediatrics have continued to advocate for, but I think for the at least for the foreseeable future, we're going to be having multi-dose valves. So the likelihood of wasting some vaccine is what we will see, but it's important to use the vaccine that we have to vaccinate those individuals who are willing to be vaccinated, because you know, it's important to get that person vaccinated when they're choosing that vaccination. So if you go to the next slide, I want to touch on this because I think that this is an area that we have frequently heard questions about. And so in the Pfizer product for 6 months through 4 years, the valve, that's the maroon cap and a maroon border, the label may say age 2 years to under 5 years or age 6 months to under 5 years. And this has caused a lot of confusion. The ACIP discussed this, and these products are authorized for use. So regardless of if the valve says 2 years to 5 years, it is able to be used down to that 6-month age range. And so this has been a big area of questions that we've received in the state and concern. And I know that's conflicting to what we have typically said to do in regards to, you know, make sure that you're following the label. This is in the EUA, which each of you should certainly review. But I think it's important to again, be checking what product your center is carrying and to go through your policies and procedures and know that this is an authorized vaccine that is being used. So if you go to the next slide, we'll kind of transition into Moderna. So here is another wall chart. So again, this was a question that people asked, you know, what are resources that are available? And later I'll be happy to drop this into the chat. But this is the breakdown of the Moderna product. Now the Moderna is somewhat complicated because, you know, Moderna just was authorized for use under age 18. So it's since December 2020, we've been using it in 18 and plus year olds, but now it's authorized all the way down to 6 months and older, but there are different products. So I want to kind of go through them a little bit. So if you go to the next slide, I'm going to kind of like break this down, but between each age group. So when you talk about Moderna dosing for ages 6 months through 5 years, it is a multi-dose valve. It has a dark blue cap with a magenta border. It's a primary series of 2 doses, 0.25 mLs each, 1 month apart for individuals 6 months through 5 years. What can get complicated is for children who are considered to be immunocompromised. They are eligible for a third primary series of a 0.25 ml of the Moderna COVID-19 vaccine. Again, the same dark blue with magenta border, authorized 1 month following the second dose. So this is where I think sometimes it gets a little bit confusing when we're talking about you know, how many doses does a person need? And we have some charts that hopefully will be helpful as well. If you go to the next slide, when we talk about ages 6 years through 11, again, it's a multi-dose valve with a dark blue cap and a label with a purple border. It's administered as a primary series of 2 doses, which is 0.5 mLs each, 4 weeks apart to individuals 6 years through 11 years. Again, for this age group, a third primary series dose, 0.5 of the same vial, is authorized for use in children who are considered to be moderately to severely immunocompromised at least 4 weeks following the second dose. And then if you go to the next slide where we're talking about, I wanted to bring this to everyone's attention. Similarly to the Pfizer product, with the Moderna product that is available, the label says booster doses only. That is what is also authorized for that primary series dose for individuals ages 6 through 11 years. So again, I think this becomes complicated, and we've seen some confusion amongst providers. So again, it's really important to be checking what product you have at your center, as well as policies and procedures of how these are being drawn up and administered. So if you go to the next slide, when we'll talk about 12 to 17 years, this is a multi-dose vial with a red cap, a light blue border. It's administered as a primary series of 2 doses, 0.5 mL each, 4 weeks apart to individuals 12 through 17. The same applies for an additional third primary series dose for individuals considered moderately to severely immunocompromised. So if you go to the next slide, we're going to kind of go through some clinical considerations that I have found that are somewhat helpful in the pediatric population. So next slide, the correct dose is based upon the child's age the day of the vaccination. So a lot of questions we've received is, my child is 4 and then they turn 5. They were 4 when they got the first dose and then they turn 5 when they would be due for their second dose, or they change in age. They have their birthday when they're due for an additional shot. And so we have some resources that we'll talk about later that hopefully can help with that, because there are multiple scenarios that are authorized. In general, the recommendation is to stick with the product that you've received. So sticking with if you started with Pfizer, finish that through for the primary series. If you started with Moderna, finish that through. And the dosage is based upon the child's age the day of the vaccination. Again, COVID-19 primary vaccination is recommended for everyone 6 months and older, regardless of underlying medical condition. There are very few contraindications to get vaccinated. And even those, if a child has a history of anaphylaxis, there is recommendation to talk with an allergist and immunologist and to assess that risk. Side effects was a frequent question. So I talked about the importance of talking about safety. Parents want to know about side effects. And so the side effects for children actually were very similar to the adults, and even milder in most cases. So the typical side effects that we saw were pain, swelling, redness at the injection site. You can see fever, which can be common after vaccines in general, but we did see fever. Moderna had a little bit more fever compared to Pfizer. Fatigue, headache, chills, myalgia, arthralgias, and we can see some lymphadenopathy with the vaccine. Routine antipyretics or analgesics can be taken for post-vaccination local or systemic symptoms. Again, aspirin is not recommended in this age group for Rye syndrome, and generally don't recommend giving those products prior to vaccination, but if these symptoms do develop, those medications can be provided. So if we go to the next slide, this is where hopefully this will be helpful. I know it's a chart. I will drop this into the chat later, but this just goes over the vaccination schedule for most people. So these are individuals who are not considered to be moderately to severely immunocompromised. This is a chart from the CDC. It goes over the doses that you can see in regards to dose 1, dose 2, dose 3, so that Pfizer-BioNTech 6 months through 4 years. And then it kind of goes through the booster doses that you can see there for ages 5 and older. We know that a booster dose is recommended, and there are some situations in which a second booster is recommended. And then it also breaks down Moderna, and then the Janssen product is there for completeness, although the Janssen product is not the preferred product. An mRNA vaccine is certainly preferred over Janssen product. If you go to the next slide, this is the breakdown for the vaccination schedule for people who are considered moderately to severely immunocompromised. So this is where you see that third dose or that third shot as the primary series. And then as you can see here, there is a booster dose recommended for some age groups. So currently a booster dose is not recommended for under age 5. And we will continue to follow that as time goes on and we continue to study these vaccines. But this is a breakdown of the different schedules depending upon the product type, the age, and if you are considered to be immunocompromised. If you go to the next slide, again, I'll drop this into the chat, but this is a reference guide that the American Academy of Pediatrics came up with. And this is what breaks down at age at first dose. So you can see there on the left side of the column, when you're looking at it, you can see the age, and it gives the product type. It also has the product label, and it kind of gives you the time between doses for each and the number of doses for the individual be considered up to date. So if you go to the next slide, I think it's important to talk about multiple vaccine administration. So the COVID-19 vaccine can be co-administered with other vaccines. The same day, a week later. This is a question that we've frequently got in the beginning of the rollout. It was recommended that you don't co-administer the vaccines, but this is now a recommendation since May of 2021. So for well over a year, we've been co-administering vaccines. If you are going to administer multiple vaccines, it's important to follow typical procedures to separate them, as you can see here, by intramore. But this is a question we frequently receive, but the vaccines can be co-administered with other vaccines. If you go to the next slide, I do want to just briefly talk about myocarditis and pericarditis. This was a question that frequently came in. There is a rare risk for myocarditis or pericarditis following mRNA COVID-19 vaccination. They've occurred most frequently in adolescent and young adult males within the first week after receiving the second dose of an mRNA COVID vaccines. There could be an increased risk of myocarditis and pericarditis in males ages 18 to 39 following the second dose relative to other authorized or approved mRNA COVID vaccines. I always bring this up, and I think it's important, and this is a question I have frequently received. The risk of myocarditis and pericarditis from the actual COVID-19 disease is much higher than the small risk associated with vaccination. If you go to the next slide, given these risks, that's where there's been a potential recommendation of an 8-week interval between the first and second dose that you'll see in those charts that I just shared. And so this is something that the person would have a discussion with an individual for 6 months to 64 age if you would want to spread that interval out between those doses. It's important to note for people who are considered immunocompromised, it's not recommended to spread that out. It's really important that they maintain whether it's 3 weeks for Pfizer or 4 weeks for Moderna. So if we go to the next slide, as I finish up here, I just wanted to offer some communication tips. So what are things to do when talking about COVID-19 vaccines? Start from a place of empathy and understanding. It's going to take many conversations. I like to relate this. This is not my analogy. I heard this somebody else and I've completely used it. It's like planting a seed. If you plant a seed, somebody else comes along and they may water that seed. And over time, that person's confidence may grow to the point that they then choose vaccination for themselves or their child. So starting the conversation is important, and revisiting it. Listen first and fully and provide information. Ask if you're able to provide information. Help them find their reason to get vaccinated. So this is some of that motivational interviewing. And then for those health providers on the call, your strong recommendation goes a long way. So I strongly recommend that your child get a COVID-19 vaccine. The shot is especially important because of your underlying health condition. I believe in vaccines so strongly. I got vaccinated as soon as I was available. And for me, it's my daughter, which you'll see in just the 2 slides, did the same. And then really wrap up the conversation with openness and a call to action. And so leave that conversation open. If you go to the next slide, I just want to share some brief things of what not to do. So really, this is hard, and this has been hard for me, but try not to repeat rumors, misinformation, or address their underlying concern. If they're worried about infertility, when I talk about that, I don't use that word. I talk about, these vaccines are safe and effective for people who are or want to become pregnant, and really get to the underlying issue that they're, addressing. So avoid the misinformation or myths, because unintentionally you may propagate that myth by repeating it. In responding, if the negative is false, the positive is true. So frame something positively. Again, if someone is talking about a negative aspect, really get to the underlying root cause of what their concern is, and address it in a positive manner. One thing that I've really tried to do in these conversations is, instead of using the word but, say and. But can sometimes be very jarring to the individual. I hear you, blah, 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 but, talk about more so, I hear your concerns, and here's a resource that perhaps you could look at to give you more information, and I've looked at this type of research, and this is what I know. Really no fear, guilt, or shame. We know that doesn't work. You don't want to have any kind of judgment and no overt persuasion or even the perception of it. It is important to tell personal stories. I've shared the story. I got vaccinated before I was pregnant. I got boosted when I was pregnant, and I had a baby girl in February, and I plan to get her vaccinated in August as soon as she becomes eligible. So if you go to the next slide, I just want to offer a few communication resources. We're going to hear next from my colleague with the We Can Do This campaign, but the CDC, the AAP has many resources along with your state. So if you go to the next slide, sorry, you'll have to wait for my daughter just a little bit longer. These are some resources we have in our state. We work very closely with our primary care association. They're a member of our joint interagency task force. Community health centers have played such a crucial role. My parents attend community health centers, so that's where they got vaccinated and where they've gotten boosted. So thank you for all the work that you do. But check with your state what resources are available. We have brandable items here that you see on the bottom that you could put your health center logo in and your clinic as to when you're offering the vaccine. So if you go to the next slide, we know that there are certainly challenges ahead, but we're here to help you in the AAP. Each state has an AAP state chapter. If you are not familiar with them, certainly hook up with them. They have resources that they can help share for your community health center as well. And if you go to the next slide, these are just some additional resources that I can drop into the chat. This is my daughter wearing her vaccine causes adults onesie after her 2-month routine vaccines. But I know we covered a lot of material in a short amount of time, and I'm looking forward to the questions we have later.
Thank you, Dr. Costello. And just to reiterate, we will be providing links and resources right after. And if we do not get to your question in the chat, we will be responding to these questions along with additional resources. So at this time, I'm going to punt over to my colleague, Erin Hemlin. Thank you.
Thank you so much. Hi, everyone. My name is Erin Hemlin. I am the Partnerships Director for the We Can Do This campaign at HHS. I want to start off by just saying a huge thank you to Wanda and Elizabeth and everyone at NAC for having me on today's webinar. Super excited to share some resources with you. You can go ahead to the next slide. So for those of you who might not be familiar with the We Can Do This campaign, this is a huge national initiative to really educate the public about COVID vaccines, increase vaccine confidence and vaccine uptake kind of in response to the pandemic. We really are kind of a massive communications campaign utilizing traditional media such as TV commercials, ads on the radio, print media, digital and social media to make sure we are getting the word out to the general public about when vaccines are available and answer some of those common questions that folks have in plain language that is, accessing folks where they are to make sure that they have the resources and the knowledge that they need to go ahead and make the decision to get vaccinated. A huge part of this campaign, in addition to kind of the general communications tools, is our partnerships campaign. You can go ahead to the next slide. So in addition to kind of our massive communications efforts, we also partner particularly with community-based organizations to really go the extra mile and make sure that we're reaching folks who may not be reached through those traditional communications channels. So this is meeting people through trusted messengers, which sometimes might be a PTA leader or a church leader, and in many cases, healthcare workers. As I'm sure you all are very familiar, pediatricians, family physicians, and other healthcare professionals are often listed as the #1 trusted resource for healthcare information. So that's why it has been really important for us at the campaign to make sure that we are partnering with folks like you to make sure we are reaching folks, in language, through folks that they trust, through resources that they recognize and can understand in order to make sure that we're meeting people where they're at and getting them the information that we need. You can go ahead to the next slide. And one of the main ways that we support our partners, again, working with some national groups like the PTAs, Boys and Girls Clubs, and NAC, but also some very small kind of what we call hyper-local organizations as well that might be working, block to block and reaching a kind of niche community, but one that is at risk and underserved and really needs those resources. So one of the main ways that we support this community partnership work is through what we call our partner website, We Can Do This. This you can find at wecandothis.hhs.gov. There you'll find a variety of different types of resources. We have tons and tons of toolkits. Almost everything is available in English and in Spanish, as well as some of our top resources in about 12 other languages. But we'll see. I'll drop a couple links in the chat here as well. But we actually just released in response to the authorization for 6 months to 4 years old, a new physicians and pediatricians toolkit that we actually partnered with the AAP to create. So this is really created for healthcare professionals like you to provide some resources that are easy to access, really meant to be kind of copy and paste material. We have a sample letter to parents. So if you need to send any communications out through your patient networks to say, hey, want to make sure you know vaccines are now available for your kids 6 months and older, we have them, please come in and make an appointment. We'll have some of those materials that you can kind of take, adapt, customize to your own needs, and then blast out. We have sample social media, sample text messages, really meant to be in any way that you tend to communicate with your community, ready to go. You can go to the next slide. So here are just a few of those examples. I pulled out some of the things that we thought might be the most useful to you. In addition to some of those kind of direct communications with patients, we also have a lot of posters and flyers that you can hang up in waiting rooms or in the community health center to make sure that it's very visible and easy to access for your patients and other folks in your community. You can see an example here of one of the posters. Those are also available in English and Spanish and have, again, some of that basic information about eligibility, about the announcement of new vaccines for our youngest, as well as about boosters, second boosters for folks 50 plus, a variety of different resources that hopefully will serve the communities that you are working with. You can go ahead to the next slide. And then again, I wanted to pull out a couple other resources specific to parents. Again, as Dr. Costello went through some of that kind of complicated information, we know parents tend to have a lot of questions. So again, we want to make sure that we're giving you as many resources that you can have at your disposal to answer those questions, either through things like this poster here that is meant to kind of help guide you through the actual, or guide a parent through the actual vaccination, as well as lots of different videos. If you have TVs in their waiting room and you want to put some videos on loop, we have tons of resources available to do that might answer some of those common questions we hear about vaccine safety or efficacy or dosage through other trusted experts like pediatricians, our own Surgeon General, as well as others. And then lastly, on the far right here, we have what we call our superhero images, which are meant to be kind of fun and positive. We have little stickers that say, I got my superpower, to help encourage kids who might be a little fearful about getting vaccinated. You can go to the next slide, please. Now, in addition to the resources and materials, we also have plenty of our partners who are doing actual events and pop-up clinics all across the country. This has been a really, really great way to actually go into communities and reach folks who maybe don't have a typical healthcare setting where they go to for care, or might be nervous about accessing vaccines either at a healthcare center or at a hospital. So for example, one of our main national partners, the PTA, has been hosting pop-up vaccine clinics at their schools and other kind of community centers, kind of really going into the community and making it easy for folks to access vaccines, to access information. So I highly encourage you to look at our website at wecandothis.hhs.gov, check out our community events, or just look at what other partners in your communities might be doing some of this work that you could partner with, maybe help them put on a vaccine pop-up clinic, or direct them to your community health center to make sure that we're reaching as many folks as we possibly can. Next slide, please. And then again, just to wrap up, I want to share a few things again that many of our partners are doing, like this pop-up vaccine clinics, really just doing everything we can to make sure that folks have the information that they need in the language that they need it, in the format that is accessible to them. Again, we have tons and tons of resources on our webpage. You can find these again by going directly to the website or signing up for what we call the COVID-19 Community Corps. This is a volunteer network of about 17,000 folks, from large national organizations and corporate groups down to individuals, friends and neighbors who just want to have the information to have these difficult conversations and have the resources to talk to their friends and families about getting vaccinated. You can go to our website to sign up, and then you'll get our latest and greatest and newest resources every other week through our newsletter. And again, I just want to say a huge thank you. I know community health centers have played just such a critical role throughout the pandemic in making sure that folks got the care they needed to get vaccinated and to really reach folks who maybe wouldn't be reached otherwise. So a huge thank you to all the work that you are doing. Next slide. And then I just want to leave you again with some contact information. There's our website where you can sign up for the community core. There's my email. Please do feel free to reach out to me if you ever need any other information or resource, or looking through our website and not finding what you need. Please feel free to reach out. I'd be happy to see if I could get you the resource you need or get you connected to any of the other partners we might be working with in your state or city. And with that, thank you so much. Look forward to any questions you might have, and I'll turn it back over to you, Wanda.
Thank you. Liz, can you go to the next slide? Next. So just in response to some of the questions that came in, we do have a series of webinars and podcasts that do help answer some of these questions. I think it's really also important, it's been mentioned before, that we're also combating mis and disinformation. And every time we have a new announcement or update, we as trusted health professionals in the community can help debunk this by getting ahead of it. So when we distribute this, there's live links to these so that you can watch the one on combating mis and disinformation. We can do this community health worker training on using, we can do this campaign materials, which I think is really useful. A lot of health centers do work with community health workers, and there's one that's in Spanish and one in English. A podcast that I just did with Dr. Costello on talking to parents about the value of COVID-19 for their kids, and then pushing back on digital spread of COVID-19, this misinformation. There is a lot of links that have been put into the chat. And so I know that there was a question that came up earlier about providing the vaccine with a live, I'm trying to catch it here. It might be for Lisa. About providing the vaccine with a live virus, something like that. I'm trying to.
Yeah, so I think this is probably targeting like those MMR and varicella, and yes, those are again, the vaccine can be administered, co-administered with other vaccines. I think obviously anytime there's multiple doses of vaccines administered, we always look for fever. But they can be co-administered with those vaccines as well.
So one of the other was around strategies on, rolling out messaging and maybe, hosting vaccine clinics so that you can target parents to come in. And my kind of recommendation is let's start internally first with our health center staff. I think that this is a complicated, thing to navigate, and our own staff employees have questions about making decisions. So if we could take some of this information to help inform our own employees, then we can also have a shared message going back out to the community. The other was we need some clarification on the 6 to 11 and 12 to 17 year old doses. Are the 12 to 13 receiving the booster at 0.25 or regular adult dose?
So I'm assuming she's talking about Moderna, or this person's talking about Moderna, because they said 6, it's somewhat complicated because we have Pfizer available now. So there are 2 products. So for Moderna, ages 6 through 11 years, it's 0.5 ml each. But again, you have to have the product specific. One thing that I think is really important is you can't try to dilute down another product. So you really have to have the age specific product of whatever vaccine that you're offering. So you need to make sure that you're having the age specific product. Certainly know it's complicated because I went over those labelings that are different. Part of that was that's when the labels, when the product was manufactured, that's how they were made. It would have been, we would have lost millions of doses, potentially if there would have been that labeling change, but certainly does provide some confusion. So for that 6 year to 11 year specific product, it's 0.5 mLs. For the 12 through 17-year-old Moderna product, it is also 0.5 mLs, but again, of that specific, which is the red cap label with a light blue border. So those wall charts that I dropped into the chat, as well as the AAP dose. And I think Dr. Montalvo found a very, also had a reference of CDC that is a clinical consideration that has all of that as well. I think, you know, I highly recommend to have these in the location where you're drawing them up. I've been following this pretty closely, and I mean, it is a nuanced item. So particularly, I think some of the questions, you know, maybe you had only been offering Moderna, so you hadn't been offering, you know, under age 18, but now you are. And so there's a lot more product types. But I do think, you know, that, you know, I think that's a great point. Find what you do best, you know, and you understand your community. I think we've seen through other vaccine age rollouts, you know, going to vaccinate people at nursing homes or taking the vaccine to individuals. We've had some health departments in my state partner with community health centers and go to places like daycares or faith-based communities. So taking the vaccine to those locations can be helpful in improving access, but certainly you want to make sure that you can do that and feel comfortable. And so if you need to understand how to administer it within your own clinic first, you know, do that before you would potentially, you know, reach out further.
Agreed. I think that the really great advice, you know, staying on message and working with our partners. There's another question here in the chat. Can you answer, if children who have had COVID recently, how long should they wait before being immunized?
Great question. So I did not cover this, but this is one of those things as well. Really, from the beginning, when you talk about information and how we have to continue to keep up with this, it's really recommended they can be vaccinated as soon as they're out of their isolation period. And so really, you're waiting that period more so to protect the person giving the vaccine than the recipient of it. You know, we have seen in time and time again that really the most robust immune responses for individuals who have had COVID and also been vaccinated. So that's why I think it's important, even if a person has had COVID, this is one of the things that I'm hearing parents are saying, oh, my kid already had COVID, I'm not going to get them vaccinated. Well, first of all, we are seeing more and more as the variants change that, you know, really we don't know how long that disease-induced immunity will last. So really that vaccine immunity is really highly recommended to stay up to date and to really provide that protection, particularly as we move forward into the fall and we continue to monitor these variants. And I did not touch on this, but you know, we do anticipate the FDA's vaccine-related biologic advisory committee met and voted, you know, to have a variant-specific booster this fall that will be for all ages. So I think that will also apply to children as well.
There's another question here. What do you tell families who say that the current COVID vaccine do not work for the new Omicron variant? And I would kind of piggyback on what you just said, that there are variants, you know, this is not going to be the first or last, but, you know, do you want to take that one on?
Absolutely. I think that in regards to, you know, the vaccines that, you know, many of these vaccines were studied when we did start to see some of those strains, and we're continuing to look forward. And I think it's important, you know, we talk about effectiveness. You know, I think just we've used this word broadly now, you know, how effective is the vaccine? What is the effectiveness? You know, we've thrown out different numbers. I think it's important to be clear what we mean by effectiveness. Both vaccines, when you're talking about Pfizer and Moderna, they're similarly effective at preventing an infection, although it's less than 50% for both vaccines. Both vaccines are much more effective, and the vaccines were really studied in preventing severe disease, hospitalization, and death. And so those vaccines have continued, particularly if you stay up to date, those vaccines have continued to do their job at preventing that severe illness and death. And so that's what we continue to expect, and that these vaccines for younger children will offer that protection that we've seen in older children and adults as well. And so I think as we see more children get vaccinated, we'll see more and more regarding the effectiveness. I think one of the things that people frequently say to me is, I got vaccinated, but I still got COVID. Well, the vaccines were studied to prevent severe hospitalization and death. And so if you do get COVID, you're much less likely to end up in the hospital or to die from the disease, as well as what we're starting to see have less likelihood of those long-term symptoms, so long COVID and potentially MIS-C as well. And so really it's trying to prevent those additional complications as well. And so I think having that protection is important, and these vaccines are safe. I've shared my story. As a new mom, it's my first child. She's just turned 5 months old. Like, I tried to do everything I can to protect her. I made sure I did my research on my car seats, and I've done my research on these vaccines, and I'll be choosing to vaccinate my daughter as soon as she becomes eligible, just to provide that additional protection, so that even if she does get COVID, I know that I've done everything to give her the best chance to not have severe disease or worse.
So we still have one ongoing confusion about, I believe it's on the Moderna. I'm trying to follow the questions around the dosing between the Moderna red cap and the dark navy. I'm not sure if you could see the questions there.
Yeah, I'm trying to be, this is certainly complex stuff, and it depends upon the age of the patient, and if they're giving, a booster dose of that 18 years and older, that booster dose is a different dose. And so I don't want to cause more confusion by answering the question, because I think it's a very specific. I think looking at the wall chart that I dropped into the chat, that particularly that Moderna one that has the magenta, the teal, which is going to be the primary series for 6 years through 11, that's not yet available to order. So you're getting that dark blue cap, purple border, and that's what you're administering to 6 years through 11 years. The red cap with the light blue border is what you're using for 12 years and older, primary series, which is 0.5. If you're giving a booster dose, which would be only authorized a booster dose for 18 years and older, at least for that product, you're looking at 0.25. So this is certainly complicated. I absolutely get it. But I would recommend kind of looking at those wall charts that the FDA has, and the AAP has tried to with our chart as well, to make it a little bit easier, because it certainly is complex. And that's why I think it's important to look at your own internal policy and procedures and really make sure you can't dilute another age volume. The Moderna product doesn't need diluted at all. The Pfizer products, most of them require dilution, with the exception of the gray product that is becoming more available. So again, it's important to know, like, what are you getting at your health center? What ages of product are you receiving? And then making sure that you're verifying, what is the proper amount to be administered if you're talking about, part of the primary series or the booster.
I would also recommend, as you stated earlier, partner with your local American Academy of Pediatrics. I think that it's important to ongoing education to really build, confidence and understanding around this. As you stated, it is complicated. And I would also, and I will continue to look, because I believe there's additional trainings available specifically to the vaccine that we can disseminate to the attendees later. I also wanted to highlight that the website We Can Do This, as far as communicating out to our own communities, that information is available, I think, Erin, in like 19 languages, if you just sort through and you click. So a lot of the content is shareable via whether you play things in the, waiting rooms or, disseminate things out. Some other ways to help educate the community, and I think health centers play a really important role here, because depending upon what state or county you live in, public health information may not be going out. So health centers are really, I think, front and center to helping to educate the community. So some health centers have hosted, like Facebook town halls with their community in partnership with others to share accurate information about the vaccine, to help answer questions that patients may have. I think it's more than one conversation. As Lisa has stated, we need to have empathy. This is complex stuff. We're asking people that are not, epidemiologists or virologists to navigate this. And it's, decision making that really benefits when our patients have a dialogue with a trusted members of our care team. And these resources are available to you moving forward. And I think it's really helpful. Yeah, there's one last question I wanted to get to, which is regarding the vaccine and preventing severe illness. What percentage of the healthy children in this age group have severe illness? I have read that efficacy at preventing illness is about 20%. Would that be a reasonable number to quote to parents? I think it's higher.
So the strategy I take is I have gotten away from quoting numbers a long time ago in this pandemic. I think it's setting us up for, a moving target, as I discussed before. And, once we see more of the population get vaccinated, and hopefully to the point where we can really vaccinate enough people around the world as well to really start seeing a decrease in strange change, it's going to be a moving target. And when we're talking about effectiveness, you're also looking at, how many people are hospitalized during that given period of time. We've seen tens of thousands of children hospitalized. I've cared for numerous children who have been hospitalized. And so in regards to severe disease, COVID-19, and if you haven't looked at the ACIP slides or you've never watched ACIP, if you're really wanting to get into the nitty gritty of the science, they are great. They're recorded. You can go back. You can hear the discussion of this independent advisory committee of these experts that discuss this with information presented from the CDC. They go over this in much more in depth along with the actual product manufacturers. And they kind of talked about that, again, COVID-19 is a leading cause of death. It's in the top 5 death for but all those age ranges. And so when we're talking about severe illness in children. And so I think it's going to vary upon where you live. And certainly, different things such as like MIS-C or other complications that you might see from COVID may not get fully related in some of those numbers as well. So I hope that helps. That's the strategy I take in regards to effectiveness, in regards to with the Pfizer for 6 months through 4 years. After that third dose, you're looking about at like 80% effectiveness. Moderna, you're looking closer to like 50 to 60. But that's what the numbers are like in the study. But again, I think at least from my experience, like when I say that to a parent, what does that really mean?
What does that mean to them? Exactly. And I think the other is that, as you stated earlier, you don't want to come with one number because, as you know, we have researchers and others that continue to monitor this and update us so that we can have accurate information to share with our, staff and our clinicians and our community. So I want to thank HHS and that we can do this in this partnership with the National Association of Community Health Centers. And thank you so much, Dr. Lisa Costello, for joining us today. This has been an incredible, informative webinar. I encourage folks that joined us today, please, 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 when we send this out, share it, retweet it, help spread the information that we have shared with you today, because we are front and center in keeping our community safe. Be safe, and thank you for joining us today.